You have been referred to Roswell Park for Mohs micrographic surgery as a treatment for your skin cancer. Hello, I'm Dr. Bax.
And I'm Dr. Brady. We hope this video will help you better understand Mohs surgery and what you can expect during your procedure.
Skin cancer is now the most common form of cancer in the U.S., with greater than 5 million cases diagnosed each year. Skin cancer forms in the tissue of the skin.
All cells reproduce by dividing. The process of normal tissue growth is usually controlled. When uncontrolled, however, abnormal growth results in masses of tissue called tumors, which can be benign or malignant. Melanoma is the most serious form of skin cancer and originates from melanocytes, the cells which produce the pigment melanin that colors our skin, hair, and eyes. Melanomas are curable if recognized and treated early before the cancer can advance and spread to other parts of the body.
Mohs micrographic surgery was first developed in 1936 by Dr. Frederick Mohs at the University of Wisconsin. Since then, it has been refined to produce impressive cure rates that we see today. When treating melanoma, we use a modified type of Mohs surgery called slow Mohs. It's called slow because the patients must wait longer for the results. Mohs surgery methodically and accurately maps exactly where the cancer cells are. Using the precision and accuracy of a microscope, your surgeon can trace the cancer right down to its roots and remove only the diseased tissue while leaving healthy tissue intact. This results in faster healing times, less scarring, and a low probability of the tumor returning.
As your Roswell Park Mohs surgeons, we are members of the American College of Mohs Surgery. This requires that we have at least 1 year of training and experience after dermatology residency and have completed at least 500 cases of Mohs surgery and reconstruction. Both Dr. Bax and I now have each performed 2,000 to 3,000 Mohs surgeries.
Slow Mohs surgery requires a team approach. As your Mohs surgeon, we will remove the tissue, and your dermatopathologist will study the cells and tissue under a microscope. On your team, there will also be a nurse practitioner or physician assistant who will assist at the surgery, specialty trained nurse or medical assistant, histotechnologist who will prepare the microscope slides.
Mohs surgery is an outpatient procedure that is usually performed using only local anesthesia. We first anesthetize the surgical site. Then we remove the visible tumor and any additional tissue or layers of affected skin. The area of your incision will be marked with small hash marks to map the area where the tumor was removed.
Next, we will temporarily dress your wound and you will be sent home. We will ask you to return the next day after we have been able to determine whether more skin must be removed or your wound can be closed. While you are away, the removed tissue is prepared for examination in our on-site laboratory. Since you are being treated for melanoma, as opposed to basal cell or squamous cell carcinomas, the preparation of the removed tissues for examination is more time-consuming. The removed tissue is dyed and divided into sections. We then prepare a map to match the removed tissue to the small hash marks we placed on your surgical wound. This way, we know exactly where the tissue has come from.
We carefully inspect the tissue under the microscope to make sure we have removed all the cancer cells. If it is determined that additional tumor is present in any of the sections, when you return the following day, the Mohs surgeon will remove additional tissue. This process will be repeated until no evidence of the tumor remains.
Skin cancers can grow deeply and develop roots that extend beyond the area that you can see. As a result, the size of the surgical incision depends on the extent of the tumor. 2 or 3 surgical layers are common, but you may require more.
When it has been determined your skin cancer has been completely removed, your doctor will decide how best to manage your wound. The decision will depend on the size and location of your wound. In some cases, the wound is allowed to heal by itself. This is called granulation. In other cases, the wound is repaired with side-to-side stitches, a skin graft, or a flap.
For either method of healing, your nurse will review written instructions on how to care for your wound at home. Thank you for trusting the Roswell Park Mohs surgical team with your care. We hope this video has answered many of your questions about Mohs surgery and what to expect.
Please feel free to ask us any questions you have before we begin your surgery.